Hi, I'm Maggie Lauken. I'm a Maryville University student and I am going to be doing my neuro assessment. My volunteer today is Dave, and we're going to start out with the 12 cranial nerves. The first nerve is the olfactory nerve, and that's going to test his sense of smell. So Dave, close your eyes. I just want you to tell me what you smell.
It smells like the onions from supper.
They're very strong, yes, that's correct. The second nerve is his optic nerve, and we're going to test for visual acuity. And his visual acuity is going to be tested using the Rosenbaum chart, or the Snellen chart, I'm sorry, for distance vision, and the Rosenbaum chart for near vision. The next three nerves that I'm going to test are 3, 4, and 6, oculomotor, trochlear, and abducens. And those three nerves will check for eye movement. And so Dave, I just want you to follow. We're going to do the 6 cardinal fields of gaze. Just follow my pen. I don't need a pen for this. Good. We're also going to check for his peripheral vision. So close one eye.
Yes. 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 Yes.
Hit my light. And then we're also going to check for pupillary dilation. Straight ahead. Good, I'm going to do that one more time. Good, thank you. The fifth cranial nerve, which although we skipped, we have to go back to it because the fifth cranial nerve is the trigeminal nerve, and we're going to be looking for muscle atrophy in his jaw and his face, any deviation or tremors. So I'm going to have you just clench your jaw. Good. And now I'm just going to have you tell me if you feel things on both sides of your face the same.
Yep. Yes. Yes.
Good. Now we'll go on to the facial nerve, that's nerve number 7, and we're going to be looking at Dave just making different faces. So like a surprise face, raise your eyebrows up. Good. Squint your eyes real tight. Good. Make a frowny face. Good. We're also checking for any droopiness in his eyes, and Dave is clear of anything wrong with his facial nerve. Nerve number 8 is the acoustic nerve, and here I'm going to be using the tuning fork, and we're going to be doing the Weber and the Rene test. The Weber test is where I strike the tuning fork and I put it on the top of his head. Dave tells me if he can hear this symmetrically in both ears.
Yes.
Good. And the Rene test is where I strike it and I put it on the mastoid process behind his ear, and he tells me when he can no longer hear it.
Okay.
And then he tells me when he can no longer hear it on the outside, sitting beside his ear.
Okay.
Good. And that worked really well. His air conduction was about twice as long as the bone conduction. The 9th nerve is the glossopharyngeal nerve. This is where I would test for taste on the back third of his tongue. I'm not going to have him taste anything tonight. The 10th nerve is the vagus nerve, and this is where we check the gag reflex. Can you say ah, Dave?
Ah.
Good, and I'm looking at the uvula to make sure that it's midline, and it is. And then I gag him. Thank you. His 10th cranial nerve is also intact. The 11th one is the spinal accessory nerve, and I am going to be checking his sternocleidomastoid as well as his trapezius muscle to see if those are symmetrical, they have strength, and there's no atrophy. So I just want you to shrug your shoulders. Good. And against resistance. Good. Turn your head side to side. Good. And against resistance. Good. Good. His 11th cranial nerve is intact. And the 12th and final cranial nerve is the hypoglossal, and we're going to look at his tongue at rest and then sticking out in different positions. And I'm checking for symmetry, atrophy, and tremors. So at rest it's fine. Can you stick it out? Good. Can you move it side to side and point it up towards your nose and down? Good. And his 12th cranial nerve is also intact. I want you to poke your tongue inside your mouth at my hand. Good. And the last thing is I want you to say the sounds of the letters L,
Ooh.
T, and D.
Good.
Good, thank you. The cerebellar functions are next, and Dave, I'm just going to have you, I'm going to check you for coordination, and I would like to, sorry, you had a mosquito on your head. I'm going to have you just flip your hands over, back and forth, as fast as you can. Symmetrically, good, thank you. And that's intact as well. Could you jump up, and I'm going to use the Romberg's test, and we're just testing to make sure that you're not able to lose your balance. He's got his eyes closed. We can note some swaying that is expected, but to actually lose balance would not be an expected finding. All right, Dave, I'm going to have you walk across the floor. Here, I'm checking for rhythm and symmetry. I'm observing his walk and his arm movements, his stride and his arm movements. Thank you, Dave. You got rhythm. Jump on up there.
Thank you.
Now for some sensory functions. First we're going to do a superficial touch. So Dave, just close your eyes and tell me where you can feel these things.
My arm?
Sure, which arm?
My right arm.
Good, thank you.
My left leg.
Good,
My left arm.
good, thank you. And for some superficial pain, we're actually going to, I'm not going to take a needle out. I do have a toothpick though, and you may feel sharp or dull.
Okay.
Okay, so just tell me if it's sharp or dull.
That feels kind of sharp.
Good,
That feels dull.
good,
That's sharp. That's sharp. Dull.
good,
Dull.
good, thank you. We're going to bring the tuning fork back out again, and I'm going to place it on your bony prominences. I just want you to tell me if you feel any vibration with this, okay? So close your eyes.
Yes.
Good,
Yes.
good,
Yep. Yes.
good, thank you. Just feel the vibration. The next thing we're going to do is I'm going to check for stereognosis, and that's just where I place a familiar object in your hand, and you tell me what it is, or what it might feel like.
Feels like the thing of chapstick, maybe?
It is a thing of chapstick.
That feels like a 1972 quarter.
It's a quarter, yes. And one more. My video has a time limit.
I don't know what that is.
I'll let you look.
Oh, it's a 22 shell.
Yes. The next thing I'm going to do is I'm going to check for 2-point discrimination. So I just want to, I'm going to keep your eyes closed and you just tell me about how far apart you feel the pokes.
12 inches. 6. 2.
Good. And then graphesthesia, this is where I am going to draw a number or a letter on your hand, and I just want you to tell me what you feel.
An L.
Good.
Not like an O.
Good.
X marks the spot.
Good. Thank you. The last thing is point location. So again, just keep your eyes closed, and I'm going to touch you in different spots, and I want you to tell me which point of your body I am touching.
My knee. Left knee.
Good.
Right wrist. Right temple.
Good. Thank you. The last part of this is the superficial and the deep tendon reflexes. So I'm going to have you lay on your back. Sorry. I'm going to start out by exposing his abdomen, just where it needs to be exposed. And I am going to check for his abdominal reflex, and I'm going to do this by moving my reflex hammer from the umbilicus away from it. And I'm just checking to make sure there's a reflex of the umbilicus kind of following towards where the reflex hammer was. And it does. Dave, you can sit up. The next reflex is the cremasteric reflex, and this is where I take the end of the reflex hammer and I go from the inner thigh, the proximal, to the distal area towards his knee, and I just watch for his scrotum to move towards that stroke. Good. And the last one is your plantar reflex, so plant your foot. Good, thank you. The last of the reflexes are the deep tendon reflexes. We are going to be checking the bicep, the brachioradialis, the tricep, the patellar, the Achilles, and then we'll also do ankle clonus. So I'm going to start here. Good. 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 We're going to go to your knee. Good. Your Achilles. And for ankle clonus. Good. Thank you. And that concludes our neuro assessment. Thank you for watching and have a good day.